Welcome to the Mind Behind the Curtain podcast, a show about the stories of incredible physician entrepreneurs who've navigated the chaos, doubt, and growth that comes with creating something new. In each episode, we'll pull back the curtain on their journeys, sharing the triumphs and struggles that led them to where they are today. I'm your host, Jenny Ekstrom, a physician, entrepreneur, and mentor. Let's take this journey together. It's time to explore the mind behind the curtain. Hello, and welcome to Mind Behind the Curtain podcast. I am your host, Jenny Ekstrom, also known as Uncluttered Mind MD. Today, I am really excited to welcome our guest, Dr. Jessica Mendelsohn. Jessica and I had the chance to meet about a year ago at a physician real estate conference and have become fast friends and confidants. So it's really my pleasure to invite you here today and for all of you guys to hear all the amazing things that she's doing. So Jessica, so great to have you here today.
Thank you so much for having me. I feel very grateful and privileged to be here. Thank you.
Oh, it's so good. I would love it. I obviously know you really well, but I would love it if you would just give us maybe just a brief story of your background and so maybe your journey through medicine and where you're at today.
Sure. Thank you so much again for having me. My name is Jessica Mendelsohn. I am a family medicine physician and I own a direct primary care practice. So when I graduated from my training, I joined a large hospital system, as I think many of us do coming out of training, for a wide variety of reasons. And for 8 years, that's where I practiced. For 3 of those years, I was our medical director and was actively involved in that large hospital system on various committees and physician leadership during that time. But when I had my first son, I realized quickly that that was not the type of medicine that worked for me. I felt like I needed to decompress and find a better balance as a mom and as a physician. So I left that practice and joined a hospice group for 5 years. And I was part-time there, also still working in that large hospital system, filling in at various practices. And soon into that was asked to be a part of a advanced care planning kind of consortium and led 2 nurses and 2 social workers in educating physicians on how to have goals of care conversations. Mm-hmm. So I did that for 2 years. I missed my family medicine patients after about 5 years and decided to go back into primary care for all of the reasons, mostly because of relationships. Mm-hmm. But I didn't want to do it the same way. So I started researching different models and what it could look like, and decided I wanted to be a business owner, knowing nothing about business, but believing in myself at the time. And I decided to open New South Family Medicine, which is my direct primary care practice, as a solopreneur. And over the last 6 years have grown it into 2 different practices. One is the family medicine practice, direct primary care, and the other is the med spa at New South. And that's led me down an incredible entrepreneurial journey, which has led me to real estate and to you and some amazing, incredible people that I couldn't have dreamed would be my circle of people. It's been challenging, it's been messy, and I wouldn't trade it for the world.
I love that. I think the most beautiful thing you said in all of that was that you knew nothing about business, but you believed in yourself. I mean, that is the heart of an entrepreneur.
I joke all the time that I had no business opening a business, but you learn as you go sometimes.
What was it about direct primary care that resonated with you?
So at the time, because I was a solopreneur and opening this practice, I needed it to be a simple model. And again, I wasn't exactly sure what that was going to look like. But as soon as I learned about DPC, I realized it was for me.
Mhm.
And that's for a variety of reasons, but mostly because I was solo and I felt like it was something that I could grasp and do as a solo physician at the time. So it made the most sense to me. I loved the idea of being able to spend a half an hour to an hour with patients. I loved the idea of home visits and community medicine. I opened my practice 3 miles from my home, in which I've lived for 15 years. So it's a small community, and I knew I wanted that to be the basis and the culture of the practice. So it made sense.
And then how did the med spa piece come to be?
So the med spa piece came about very serendipitously. I knew going into DPC that my procedure volume wouldn't necessarily be as robust as it was in a fee for service large practice. I also knew that in DPC, one caps their memberships.
Mhm.
So I wasn't exactly sure what that number of patients would be, but I knew I wanted another stream of revenue coming into the practice. So I got certified in Botox and injectables and just sort of started a little bit with my friends, and developed a bit of a following. And then COVID hit, and I stopped doing that completely. But about a year and a half after COVID hit, I was approached by three women who worked at another med spa and wanted to grow. And they saw what I was doing on the DPC side. They knew I had done some aesthetics work and was getting back into that. And it was a tremendous leap of faith because it had been myself. And at that time, I had an MA. It had just been the two of us for 2 years, trudging through COVID and all of the challenges that came along with that. But I took a leap of faith and hired the three of them, and it exploded uh, on both sides of the practice. So it's been a great addition, and they feed each other. It's been really cool to grow.
So what does your practice look like today then?
Very different than it did 5 years ago. So I employ 16 people, and one of them is my husband, who is a family medicine physician as well. He was my first physician hire. I am just blown away by the growth and what's coming as well. So yes, there's 16 of us, and it started out as just little old me.
I love that. Like all business ventures, right? It starts out as a dream and then all of a sudden, look at what
Yes,
you've created.
yes,
Now, I think there's this misconception that, I obviously am in independent practice. I'm not DPC and accept all different payer models, but I think there's this idea that somehow everything is easier in DPC. How would you respond to that? Patients just pay a membership model and everything's covered, right?
sure. Um,
Just like that
no,
we have insurance premium in standard practice and everything's covered,
right,
right?
exactly,
Yeah.
exactly. So I say a lot of the time, I have learned more about insurance and what it is and what it is not by not accepting insurance than I feel like I ever knew when I was working in a hospital system, because it's all out there and exposed. And so it's me that my patients are coming to. It's not someone in a call center that is paid to manage their reimbursement or prior auth or whatever those things are. I- it's us, and it always comes back to us as a practice. And so I say a lot, I work just as hard, if not harder, than I ever did. However, the work that I'm doing for patients is to me more meaningful. It's
Mhm.
more about the advocacy, it's more about navigating the system, it's more about that relationship that it was when I worked in a large system with lots of other people doing things for me that I didn't know what they were doing.
Right, right.
So yeah, a lot of it falls back on us now.
Mhm. Yeah, I would say the same holds true in a traditional practice too. We are obviously outside of any large medical system. And so, yeah, the buck stops at when the insurance says, we don't want to cover this medication or we don't want to cover this procedure. It's me who gets to get on the phone to say,
Exactly. And as we have said to each other before, primary care is primary care, regardless of the model, right? There's so many different types of ways to practice, and we all feel some of those same pain points. I tell patients I can control cost and transparency with when it's within my four walls,
Mhm.
but I can't always control what's going to happen outside of my four walls. And I want us to be prepared and work together as a team to get you what you need. I just don't know what that might look like.
So, what are maybe some of the examples that you have had to be creative to get them the care or the referrals or those things that they needed?
Sure. So many different ways. And again, one of the things that I have realized in all of this is how many incredible people there are practicing outside of a hospital system.
Mhm.
That includes specialists, that includes dietitians, that includes physical therapists. There's just so many people doing amazing out of the box things that there are resources available that I didn't know were available. So I've gotten creative with imaging and referrals on where I send my patients for imaging. I
Mhm.
have some wonderful colleagues that have X-ray and CT and MRI. So my patients who are paying cash have a negotiated price
Mhm.
at perhaps a neurologist's office for their MRI or an orthopedist for their chest X-ray. So
Mhm.
it's been a really interesting journey to see how many different people can offer creative care, if you will.
And then how are your patients using insurance? Do you find that mix is primarily an under like a cash pay only no insurance model, or do you feel like you've got folks with high deductible plans, or
Mhm.
what sort of safety nets do you encourage your patient population to have so that you can best help them get the care they need?
Absolutely. I think it's important to say to all of my patients, I want you to have some type of insurance and coverage. And what that looks like is different for everyone. I sort of subdivide it into three different types of patient.
Mhm.
One is completely uninsured. So we are the most cost effective person that
Mhm.
those people can afford. And so we tend to be their stop for everything, which is wonderful and challenging all at the same
Mhm.
time, right? So it's wonderful to be able to offer that service to someone who isn't necessarily able to afford other care.
Mhm.
um, Perhaps they make too much to meet Medicaid criteria, but not enough to be able to afford private insurance. And so we are what they've got, and we do the best we can
Mhm.
in that environment. Then I have a lot of patients who have high deductible plans or are underinsured and are paying out of pocket regardless of the fact that they pay a premium every month. So we encourage them, do you have a health savings account? Do you have something that you can use to offset some of the cost of what we provide? And then I have people who have insurance that their premium is reasonable or their deductible is low, but they see the value in the care that we provide and want that personal feel. They want that advocacy. They are frustrated with perhaps experiences in the healthcare system in other models and have recognized what we are able to provide them, and so they pay for that service regardless of their insurance.
I love seeing all of those different patient types. And I would say we see a lot of the same, not the person who is large, well, we see the uninsured, but not on that ongoing
Mhm.
basis because healthcare is obviously really costly. What would you say to someone who's maybe coming out of training who says, gosh, I'd really like to dive into DPC. What things do I need to be thinking about?
Sure. I think there are absolutely challenges in starting a DPC practice. One, in part because you're starting a small business. And so, what does that look like? What does your growth projection look like? How quickly are you able to establish a patient panel? What what is your debt rate coming out in terms of student loans? Is that prohibitive for you? How can you get some creative financing to be able to start a practice, and how good are you at building it?
Mhm.
So that's not for everybody, and that's okay. If you're interested in that DPC model and you're interested in ownership and starting a practice, I absolutely think that's doable. It just might look a little bit different than opening up a practice with 3 exam rooms and a staff, right? So it can look however you need it to look coming out of practice, or excuse me, coming out of training to start your practice how you want. It can also look like employment at another DPC practice. And so I would encourage somebody to pick up the phone and call. We love talking about it and we love this movement. And perhaps there's someone looking for a partner. So there's multiple different ways, I think, to start a practice soon after training, and being creative in what that model looks like for you.
I love it. I love it. So, what would you have to say to someone like me, who's your colleague? We're taking care of patients across the continuum. I think sometimes when we look at this, it's like, oh, it's either DPC or it's insurance-based practice. What would you say to somebody who says, gosh, we're more different than we are alike?
I would say that we're actually more alike than we are different, right? I think that, again, coming into this as primary care physicians, and that includes multiple different types of primary care, right? Um, our goal for our patients is the same. We want to advocate for them. We want to help them navigate the system, as we've talked about. And so it's choosing the model and the lifestyle that works best for you.
Mhm.
I love that you are an independent physician. I love that you own your independent practice, regardless of what that model is. I think it's important to know there so much has changed, I think, from coming out of residency almost 20 years ago. At that time, it felt like there was no option, at least in my region and where we live. It felt like if I wanted to practice medicine in the Charlotte region, then I was going to work for one of two hospital systems, and that was it. What I love so much about these conversations and how available information is now is that it's helping people to recognize that so many other things are possible. So
Mhm.
many different ways to practice are possible. And one of those many ways is DPC. And if that's fitting for somebody, then that's wonderful. If it's not, there's information everywhere where you can find what is right for you.
And that is definitely what I've seen in independent practice,
Right.
right? Where a lot of the same things that you were looking for in terms of like autonomy over your schedule. Like, how do I set that so I have the time with my patients that I want? And
Right.
fortunately for me, being an independent practice, it took me a while to realize that I had the control over my schedule, but in fact, I do. And no one tells me that I can't spend that time at the end of the day, like in any business, what we produce is what we take home. So there is that pressure, but finding those pieces that light us up in medicine is what helps keep us in medicine. And that's why I think these conversations are so important, because you may have gone through your training. And I think you and I have both gone through these periods of disillusionment of, is this all there is? And I can't imagine that this is what I worked so hard for.
Mhm.
And then finding a way to finding that joy in those patient connections when you're able to get them the treatment that they need and help them navigate that system. And you're the first person they say, gosh, nobody's ever done this for me before.
Right.
I think we see
Exactly.
that in both of our practices.
Absolutely. And there is this fallacy that I think might be out there in terms of DPC, and as some of my colleagues have said, cherry picking patients. And my response to that is always, my patients choose me.
Mhm.
And that is because of the culture that we've created in this practice. It's not me choosing them. And we take care of so many different types of people. And it's it's pretty remarkable. And I don't choose who walks through the door. We're going to take care of whoever that person is, and with whatever needs they have. And so I tend to disagree with the idea that it's choosing my panel, because it's
Well, and I think one of the things that I have often struggled with, and I don't know, I know initially, at least in the beginning, DPC and the ability to practice DPC was very state dependent, and there were some states that just did not allow that.
not.
And we still see that flood over primarily in the Medicare and Medicaid population, such that when you're someone like myself practicing in a small community and you are the place that everyone comes for care, in order for me to open up a DPC practice, I can no longer bill Medicare for 2 years,
Right.
which, so I think that piece, it proves that we need all flavors for patients, because there are going to be patients who come to you who maybe do have insurance and would love your care, but you're like, gosh, in order to get some of these things, let's maybe plug you into a traditional practice so that you're not having to incur these costs on your own. And maybe
Sure.
some of that you navigate, but I believe you've maybe told me about patients like that you've had in the past.
Yeah. So again, having both is so great. So um, I am opted out of Medicare, and that is a common theme in
Mhm,
DPC. And that actually allows me to take Medicare patients.
mhm,
So I have a good number of patients, and my husband has a good number of patients that are Medicare patients. But what that all that means is that I cannot submit for
right.
reimbursement
Yeah,
for my care. It doesn't mean they cannot use their Medicare anywhere.
right.
So if I'm ordering radiology from one of my patients who has Medicare, then the radiologist and that group is who's getting paid. I would not submit for, say, that visit,
Yes,
right?
yes.
That's all that means. Where it's a challenge is in someone who's opening a direct primary care practice and perhaps moonlighting somewhere
Mhm,
else.
exactly.
That's or is opening a hybrid practice. That's where it can be challenging, but there's absolutely multiple people doing that,
Mhm,
and nationally, who have figured that out. So yes, absolutely. And I also, on the flip side, give the story of, while my husband was still working for the larger hospital system, he had a patient who had recurring gout and had no insurance. So, because he couldn't afford certain medications, they used a lot of prednisone. So, he then developed diabetes,
mhm,
and then required him to have labs every 3 months and come in. And it was getting astronomically expensive for this patient. So, my husband actually said, meet my wife who has this practice. And he's been with me ever since.
mhm.
And we've gotten everything under control because he can afford to do it.
Oh, I love that.
Even now that Dave is here, this patient still wants to see me. We joke about all the time, but we were able to control all of those things because I could actually get him to come in on a regular basis and get things under control.
That's fantastic. Yeah. Oh, I love that. So then, I mean, and this is what I love about chatting with you about DPC because I continue to learn things. And my ultimate goal would be like, how do we hybridize that into what we're already doing, right?
Right,
We can just
exactly.
continue to provide all these different models. But I know that this is a passion for you in educating other physicians. So where do you think that piece will take you? What's on the horizon for you?
So many places. I love this model because of what we've built here and because I have seen physicians light up and be able to practice in a way they didn't think they could, while also not sacrificing their lifestyle.
Mhm.
And so perhaps in the beginning, as you're building your business, but over time, when you are able to navigate and have your panel, it's you're still able to live the life that you want to live and own a business. So I love talking about that. I love talking about the idea of maybe you don't want that and you want employment in a DPC practice. There's those options as well. So my passion has become bringing as many physicians into independent practice as possible so that we regain some control over our healthcare system, so that we regain clinical control and have autonomy in how we practice, regardless of the model. If someone's interested in doing that in a DPC fashion, then I love the idea of guiding them through that. So for specifically for us and for New South, my goal is multiple locations
Mhm.
and bringing physicians on board that want partnerships, that perhaps want to make sure they still have ownership in a practice while having the support they need from physicians
Mhm.
that are available to help them along their entrepreneurial journey. So I think there's lots of ways to speak to it and to be a part of it and grow it.
And I know that you are becoming a very well-known voice in this sphere, and it's so fun to get
Good.
to highlight and just to hear it, and like I say, to learn for you. So I cannot wait to have this conversation a year from now and see. Do you remember when I just had 16 employees? That was it. And we had just like grown out of our second building we just built.
That's so funny. I love the idea of having this conversation a year from now and thinking through ways that we can help physicians blend different models and be creative together.
One of the questions I love to ask because I think that we learn a lot from our future self. So, what would yourself tell yourself now, tell your younger self about this journey? What lessons have you learned that maybe would give that younger version of yourself a step up?
Mm. Say yes and be present. I think that what I've learned about who I am in the last 5 years, I'm so very, very different than I was coming out of training for a lot of different reasons, life experiences, personally and professionally, of course. But say yes and trust yourself and bet on yourself. I have said recently in different conversations that it's okay if it's messy. It's okay if you still have some imposter syndrome. It's okay if you're not sure what that next step is going to be, but saying yes and trying and and taking a calculated risk on yourself is the best decision. At the end of the day, each time I've done that, it's been the right decision. So that's what I
That
would say.
that is beautiful. Oh my goodness.
Mhm.
Oh, Jessica. So great to talk to you. If we have listeners who want to connect with you or learn more from you, what's the best way for them to get a hold of you?
Absolutely. So my email is Dr. Jessica, Dr. Jessica at newsouthmed.org. I'm on Instagram and Facebook and all those fun things. You can connect to us or connect to me through our website as well. But just email directly is going to be the best bet. I check that multiple times a day, as most of us do.
Yes, exactly. And we'll definitely include ways to get a hold of or to get in contact with Jessica in the show notes as well. Thank you so much for taking the time to chat with me.
Likewise, thank you for having me. I love this and I love what you're doing and creating in terms of a space for people's stories and experiences. It's just awesome. Thank you.
You're welcome. Such a pleasure. All
Always.
right. We'll chat soon.
That sounds great. Thank you, Jenny.
Thank you for joining us on this episode of Mind Behind the Curtain. If you enjoyed today's episode, be sure to subscribe and leave a review wherever you listen to podcasts. And don't forget to share this with someone who needs to hear it, because often the answers we're searching for are already within us. For more inspiration and behind-the-scenes insights from amazing physician entrepreneurs, visit us at unclutteredmindmd.com or follow us on Facebook and Instagram at unclutteredmindmd. The curtain's always open.